Hello everyone, I'm Charissa Jessurun and I would like to tell you something about the combined use of steroids and immune checkpoint inhibitors in brain metastasis patients, a systematic review and meta-analysis. I have no disclosures. Immune checkpoint inhibitors have been a great breakthrough in oncology, including brain metastasis patients, and steroids are an integral component of symptom management in brain metastasis patients. However, the immunosuppressive effect of steroids might counteract immune checkpoint inhibitor mechanisms. For these concerns, 40% of the immune checkpoint inhibitor trials consider steroid use as an exclusion criterion. The implication of these concerns for treatment of brain metastasis patients is unclear until today. So the aim of this study is to perform a systematic literature review and meta-analysis on the association between steroid use and overall survival in brain metastasis patients receiving immune checkpoint inhibitors. We performed a systematic literature search in several databases in July of this year. We included all study designs with more than 5 patients. We included studies with brain metastasis patients or studies that reported on a brain metastasis subgroup. And we included studies that included patients that received treatment with immune checkpoint inhibitors and steroids. The primary outcome of this study is overall survival. The secondary outcomes are progression-free survival and treatment response. The latter one we won't discuss in this presentation. The pooled effect estimates were calculated using random effects models in R. After screening 1,145 abstracts, 15 studies were included, of which 14 studies were included in this meta-analysis. All studies described a total of 1,102 brain metastases patients, of which 32% received steroids. The median overall survival of the steroid group ranged from 3 to 10 months, and the median overall survival in the non-steroid group ranged from 5 to 25 months. Pooling the results for overall survival demonstrated a statistically significant mortality disadvantage of the use of steroids versus no steroids, with a hazard ratio of 1.8. Stratified analysis by primary tumor type indicated similar effect sizes for melanoma brain metastasis patients with a hazard ratio of 1.7 and brain metastasis patients with mixed primary tumors with a hazard ratio of 2.5. For non-small cell lung cancer brain metastasis patients, no significant association was seen between the use of steroids and overall survival. Pooling the results of the 5 studies reporting on systemic progression-free survival showed a statistically significant association between worse systemic progression-free survival and the use of steroids in comparison with the non-steroid group, with a hazard ratio of 2 in favor of no steroids. There was no significant association seen between the use of steroids and intracranial progression-free survival. So in conclusion, steroid use is associated with worse overall survival and worse systemic progression-free survival in brain metastasis patients receiving immune checkpoint inhibitors. Future research is needed to elucidate the optimal treatment combination, for which it's important to also take into account confounders, including the presence of symptomatic brain metastasis, an optimal timing of immune checkpoint inhibitors, and lastly, the dose and duration of steroids. Thank you.